Okay, so let's talk about some Hodgkin's drugs. Obviously, these are going to be cancer drugs, and we're going to be talking about only the drugs which relates to Hodgkin's disease. Okay, so before we start, let's talk about what kind of cells we're going to see in Hodgkin's disease. We're going to see Reed-Sternberg cell, which looks like binucleate nucleus, bilobe nucleus with lots of eosinophils in the cytoplasm, which looks like a lot of dots or a lot of things in the cytoplasm. Okay, so let's talk about Hodgkin's drugs. There is 3 groups of drugs which is often tested, and they are, the first one belongs to the anti-tumor drugs, and the name of the drug is Doxorubicin. The next one is also anti-tumor drug, anti-tumor, and this one is Bleomycin. Bleomycin, okay. And the last one is microtubule inhibitors, okay. And those drugs are Vincristine and Vinblastin. I think only one is used for, only Vincristine is used for Hodgkin's. Okay, so let's talk about Doxorubicin. Another name for Doxorubicin is Adriamycin. ADR, how do I spell it? ADRIA. Adriamycin. Now, what is the mechanism of action of Doxorubicin? Okay, mechanism of action. It generates free radicals, okay, and generates free radicals which intercalates in DNA, and it binds to it covalently. Okay, binds to it covalently. What about the clinical use of Adriamycin? We already know that one of the clinical use is non-Hodgkin's, but let's talk about all the clinical use. The clinical use I remember by using a mnemonic, and the mnemonic is MSSA, MSSA. The last one starts for, the last one represents Adriamycin or ABVD regimen. This is one regimen used for non-Hodgkin's, and the A stands for Adriamycin. The other ones, M stands for myeloma. We talked about how these are anti-tumors. This one is myeloma. S is for solid tumors. The other is for sarcoma. Okay, so MSSA. What about the toxicity? MSSA, CMA. If you remember, I talked about it a little while ago, but not specifically for Hodgkin's. So C is for cardiotoxicity, M is for myelosuppression, and A is for alopecia. Alright, so that's about it. That's about Adriamycin, followed by Bleomycin. Okay, Bleomycin. What is the mechanism of action of Bleomycin? This one also generates free radicals, okay, but it does it in a specific phase, and it does it at the G2 phase, at the G2 phase. Okay, what about clinical use of Bleomycin? Clinical use and toxicity, I do it together for this one, and the mnemonic that I use is PAST, P-A-S-T. P for pulmonary fibrosis, which is a toxicity. A is for part of the ABVD regimen, where it's, you know, ABVD regimen, so Hodgkin's. S is for skin changes, okay, and T is for testicular cancer, and it causes very little myelosuppression, so I didn't bother with that one. Okay, so that's about bleomycin. Last but not the least is vincristine. What is the mechanism of action of vincristine? Mechanism of action is that they are microtubule inhibitors. And how exactly do they do it? They don't let microtubules to form, so it does not allow microtubules to form. Okay, they don't allow microtubules to form, and the work at the M phase of the cell division. Okay, all right, so that's the clinical mechanism of action. What about clinical use of vincristine? There is a mnemonic that I often use for this one too, and that one is chow. Like a chow, I don't know, chow like a Chinese word, chow. I'm not trying to be racist or anything, but somehow I remember it. C is for choriocarcinoma, H is for Hodgkin's, O is for MOPP or MOP regimen. That's another regimen used for Hodgkin's. And W is for Wilms tumor. Okay, chow. And the toxicity of vincristine. The toxicity of vinblastine is to blast the bone marrow. Toxicity of vincristine is neurotoxicity, paralytic ileus. So neurotoxicity would include peripheral neuritis, areflexia. So they're going to have neurotoxicity followed by paralytic ileus. Okay, so that's about it. I will add these notes onto my blog, and the blog address should be right below this video. So please do check my blog. If you want to add anything to it, please feel free to do so and leave me a comment or a video response. Also, please like and subscribe if you do like these, or if you feel like these are helping you. Spread the word and help me out at the same time. Okay, so that's about it, and I will see you in my next video. Bye for now.